When we try to explain to people what they have, we tell them this is the medical term for dandruff, but yes, you can get dandruff in other areas. It's just known as seborrheic dermatitis to us. The most common signs and symptoms of seborrheic dermatitis are redness on the scalp, scale on the scalp, and itch. Once in a while, someone will mention a more persistent itch that they have, but mostly people come in for a flaky scalp. Seborrheic dermatitis can affect other areas besides the scalp, what's called the nasolabial folds, which are the folds of skin that are next to your nose, the eyebrows, the center of the eyebrows, which is called the glabella. And then sometimes in your central chest, sometimes in the pubic area, people can have seborrheic dermatitis. On darker skin tones, patients can have either lightened areas where their skin's inflamed, or it can be darker. So it doesn't look red on darker skin tones. There's just a change in pigment often. When babies and young kids, it can present as something called cradle cap, and it will look like scales that are stuck to the scalp. And to remove them, it's a bit of a challenge. You have to wet the scalp down with oil often and then use a fine-tooth comb to remove the scales. If you think you have symptoms of seborrheic dermatitis, trying an over-the-counter dandruff shampoo is perfectly acceptable as a first step. If you don't get better, then I would recommend seeing either a dermatologist or your primary care doctor for next steps.